Hello, my name is Stephen Cox, and this will be a short presentation on falls prevention and how a healthcare organization can decrease their preventable falls that occur within their organization. Falls are a major safety concern for every healthcare facility. Joint Commission has made it a point by making it a national patient safety goal for preventing falls. And that reason is due to, most of the population in an inpatient setting are older people, and a fall for the older population could be extremely detrimental. For some older patients, it could cause death. And the reason why this is so important for the nursing population is because in an inpatient setting, the nursing section is kind of held responsible for preventing falls. We're at the bedside the most, and we are the ones that are usually implementing the interventions to help prevent falls. The definition of a fall is a sudden unintentional change in position causing an individual to land at a lower level on an object, the floor, or the ground. The reason why fall prevention is such a challenging process is because it requires each discipline within the healthcare organization to be dedicated to the safety of the patients. That means physicians, nurses, PT, OT, and even the housekeeping staff can all work together to improve falls. As far as statistics for falls, it is 82% of inpatient falls actually just occur in the patient's room, where 85 were unassisted, and 47% of the falls were involving toileting activities, whether it was walking to the bathroom or with a bedside commode. So these are all kind of falls that can be prevented with the working together of all disciplines. Falls are a major safety concern, but they also can cause an extreme financial impact on a healthcare facility and the patient. Research has shown that falls can increase the length of stay of an inpatient stay by over 6 days. 30 to 35% of those patients who fall will sustain an injury. And with that injury will mean more tests, possible surgery, possible lengthy outpatient rehab placement. And the Joint Commission, they estimate that the average cost of a fall with an injury is an extra $14,500. $14,500. Another financial impact would be the Center for Medicare and Medicaid will no longer reimburse for the cost of a fall. So any injuries that are sustained from a fall will have to be covered by that healthcare organization. Falls are measured by patient safety reports that are created each time a fall occurs. These patient safety reports will create statistics for each section within nursing, whether it be medical, surgical, ICU, or PACU. After that, each floor will then conduct their own analysis of what happened during those falls, whether it was staffing concerns, maybe employee training, or the appropriate measures were not taken to prevent falls. Each quarter within the hospital, each quarter of the fiscal year, the fall total is analyzed, and a plan for remediation will then be established. My organization for remediation developed a falls team that was created to kind of respond to each fall that occurred, where they were able to interview the staff and kind of um, interview the staff to see what occurred and what led up to the fall. This was not this was not placed in the patient record, so it was an opportunity for the staff to kind of candidly give their opinions on why the fall occurred. Fall prevention was also complete. Fall prevention education was also completed at each skills fair and also at new employee orientation. And also a new 3 level of falls risk was used with the corresponding color as far as socks, and also a spot on the board that can alert anyone on the fall level that the patient is at. Exercise should be used to help prevent falls. It has been shown that exercise can reduce falls by 13 to 40%. I believe that the older adults will benefit the most from exercising because most of the falls that have occurred have been noticed that the patients had a problem with their gait, balance, or strength. They were cognitively able to notice their surroundings and their limits, but once they were getting up, they were falling due to um, their lack of physical activity. The Center for Disease Control and Prevention also recommends exercise to help with fall prevention, and they have on their website many different exercise programs that can occur. So nursing would have to collaborate with PT to kind of develop some plans to get patients stronger and able to um, walk more efficiently. Most of the patients that are falling are not on high falls risk. They are low and moderate risk. And these are the patients that are allowed to get up and move about their room and go to the bathroom without alerting the nurse for assistance. And I believe that education should be tailored towards these individuals with focus on safe environment and understanding when assistance is needed. If there's a certain change in medication, that could cause a change in their fall risk, and education should be given then by the nurse to alert the patient to use the call bell more often. Hopefully, with this increase in education, falls will be reduced. In my organization, the current plan for remediation that involved the falls team, increased education, especially at for new employees and also for existing employees at the biannual uh, skills fair, has helped with decreasing falls. The falls team, they meet, I believe, once a month, I would like to say, and they are able to kind of brainstorm on all the falls that occurred and implement new strategies on how to improve. I've also noticed since the new system of falls risk that a team effort has been applied with all the disciplines kind of working together with physicians, making sure when they do their morning rounds that all the falls precautions are in effect. And also we do have kind of permanent housekeeping staff on our floor that kind of goes in and makes sure that the room is clean, that the floor is dry, and that the environment is safe for the patient to move about. From a leadership perspective, um, there may be some difficulty on getting kind of a exercise regimen for patients in need and also implementing it because I think it will take intense collaboration with the nursing, physician, and PT staff. Staffing would be a concern with the PT department being able to come around and do an initial visit to make sure the patients that are able to get up and walk, that their balance, that their gait and strength is up to par. So from a leadership perspective, the nursing leadership would have to kind of create a plan that could implement kind of increasing the activity for our patients. As far as with the increasing education, I believe that will just take the leadership to encourage staff members to educate their patients and family members on each of the falls risk and what can help prevent falls. Having daily audits on the floor will also kind of um, keep the staff alert to make sure that they are doing everything in their power as far as charting, accurate assessment is being done to help with the movement for preventing falls.